Welcome to the podcast. My name is Dr. Noor Gajraj. Let's talk about Alzheimer's disease, facts and figures. Alzheimer's disease is a progressive brain disease that causes damage to nerve cells, neurons. It is the most common cause of dementia. The brain changes associated with disease begin 20 years or more before symptoms appear. It is a progressive disease, meaning it gets worse over time. The first neurons affected are typically those in parts of the brain responsible for memory, language, and thinking. It's important to understand the difference between the two terms, Alzheimer's and dementia. Dementia is a general term for a group of symptoms, including problems with memory, language, and problem solving that are severe enough to affect daily life. Alzheimer's disease is the most common cause of dementia, accounting for an estimated 60 to 80% of cases. Dementia caused by Alzheimer's is called Alzheimer's dementia. Brain changes in Alzheimer's disease. Key biological changes in the brain that are associated with Alzheimer's disease. Beta amyloid plaques. Clumps of a protein fragment called beta amyloid that accumulates outside neurons, interfering with communication. Tau tangles, abnormal twisted strands of the protein tau that build up inside neurons, blocking nutrient transport and damaging connections. Neurodegeneration, the death and destruction of neurons and other brain cells. Brain atrophy, decreased brain volume due to neurodegeneration. These brain changes can now be measured as biomarkers using techniques like PET scans and blood tests, which help in earlier diagnosis and research. The Alzheimer's disease continuum. Preclinical Alzheimer's disease. Brain changes are present, but there are no noticeable symptoms. Mild cognitive impairment due to Alzheimer's disease. Subtle new symptoms like memory and thinking problems are present, but they do not interfere with daily activities. About 1/3 of individuals with mild cognitive impairment develop dementia due to Alzheimer's within 5 years. Dementia due to Alzheimer's disease. Noticeable symptoms that impair a person's ability to function in daily life. This stage is further categorized as mild, moderate, or severe. Risk factors for Alzheimer's dementia. Some factors are unchangeable, while others can be modified. Unchangeable risk factors. Age, the greatest risk factor. The percentage of people with Alzheimer's dementia dramatically increases with age. 5% of people aged 65 to 74. 13.2% of people aged 75 to 84. 33.4% of people aged 85 and older. Genetics. The ApoE gene is the strongest genetic risk factor for late onset Alzheimer's. Family history. Having a first degree relative with Alzheimer's dementia increases risk. Modifiable risk factors. Cardiovascular health, physical activity, and social and cognitive engagement. Addressing these may help reduce the risk of cognitive decline and dementia. Disproportionate impact on women. Alzheimer's disease affects women more than men. Nearly 2/3 of Americans with Alzheimer's are women. Of the 6.9 million Americans aged 65 and older with Alzheimer's dementia, 4.2 million are women and 2.7 million are men. At age 45, the estimated lifetime risk for Alzheimer's is approximately 1 in 5 for women compared with 1 in 10 for men. This is partly due to women living longer on average, but research also suggests that a combination of biological and environmental factors may increase their risk. Racial and ethnic disparities. Certain racial and ethnic groups face a higher risk of developing Alzheimer's or other dementias. Older Black Americans are about twice as likely to have Alzheimer's or other dementias as older white adults. Older Hispanic Americans are about 1 and 1.5 times as likely to have Alzheimer's or other dementias as older white adults. These disparities are not primarily due to genetic factors, but are likely rooted in historical and ongoing inequalities in life experiences, socio-economic status, and health. A growing epidemic, the number of Americans with Alzheimer's is projected to increase dramatically. An estimated 6.9 million Americans aged 65 and older are living with Alzheimer's dementia today. This number could grow to 13 million by 2060 if no breakthroughs are made to prevent or cure the disease. Mortality and morbidity. Alzheimer's is a leading cause of death and disability. In 2021, there were 119,399 deaths officially attributed to Alzheimer's disease on death certificates. However, the disease is often underreported as a cause of death. From 2000 to 2021, reported deaths from Alzheimer's disease increased by more than 140%, while deaths from heart disease, the leading cause of death, decreased by 2.1%. At age 70, people with Alzheimer's dementia are twice as likely to die before age 80 as those who do not have the disease. Caregiving, the unpaid workforce. The majority of care for people with dementia is provided by family and friends. More than 11 million Americans provide unpaid care for people with Alzheimer's or other dementias. In 2023, these caregivers provide an estimated 18.4 billion hours of care, valued at approximately 34.6 billion. The vast majority of dementia caregivers, 66%, live with the person they care for. The cost of Alzheimer's. Dementia is one of the costliest conditions to society. Total payments in 2024 for healthcare, long-term care, and hospice services for people with Alzheimer's or other dementias are estimated at 360 billion. Of this total, Medicare and Medicaid are expected to cover 231 billion, 64%. Average per person Medicare payments for beneficiaries with dementia are almost 3 times greater than those for beneficiaries without these conditions. Looking to the future, the Alzheimer's crisis presents a significant challenge to individuals, families, and the healthcare system. With the population of older Americans expected to grow, the need for effective, compassionate, and coordinated care is more critical than ever. Initiatives like the CMS Guide model are a step towards creating a system that supports both the person living with dementia and their caregivers. By investing in research, supporting the caregiver workforce, and improving access to care navigation, we can work together a better future for all affected by this disease. Thank you for listening. Please consider my book, buying my book, 100 Pathways to Longevity, and subscribing to this channel.